March is Colorectal Cancer Awareness Month, which is really important because colorectal cancer is now the leading cause of cancer deaths in men under the age of 50.
The rise in colorectal cancer among young adults is an alarming trend. Joining us this morning from Dana-Farber Cancer Institute is Dr. Jeffrey Meyerhart. Thank you so much for coming in and joining us this morning. It's such an important thing to talk about. Why are you seeing so many more young people being diagnosed with colorectal cancer?
Yeah, we don't really know. I mean, there definitely has been a rise. We know that. Where before there was, a small number of patients relatively under the age of 50. Now it's 11% of colorectal cancers are under the age of 50, and actually rectal cancers is about 20%.
Wow. So when should people start getting screened for colorectal cancer then?
Yeah, the guidelines changed several years ago to start thinking about screening at 45 and above, but we know the age from 45 to 50, only about 20% of patients are getting screened, and even from 50 to 55, it's only about 50% of patients. So we don't know if it should go younger and what type of screening, especially under the age of 45, but at least at age 45, we really strongly recommend people getting screened.
You talk about the push to get more men aware of this and to potentially get checked a lot sooner. Why this push to gear towards men?
Yeah, I mean, again, it's the leading cause of cancer-related death now in men under the age of 50. So, we know that people ignore symptoms. So in addition to screening, we also have to make sure people are aware of symptoms. And if you have symptoms, to bring that up to your physician. That doesn't definitely mean you have cancer, but we want to be able to check and see.
What are those symptoms?
Yeah, sure. So one symptom is blood in the stool, but a lot of patients won't have blood in stool. Change in bowel habits. If you start seeing you're not going as well, or there's some change in the caliber of the stool, that's reasons to bring it up to your physician. Again, that might not be cancer related, but we want to make sure.
We were just talking, women, we seem to be really in tune with our health, going to our checkups. Are men kind of in that same line, or do you think they need to be more, I guess, in tune or proactive and going to those checkups and whatnot?
Yeah, no, you're absolutely right. And I think some of it is, for women, there's other screening things that you actively do, so mammogram screening, cervical cancer screening. For men, prostate cancer, you may consider screening, but definitely as you're older. So yes, men in general don't have things that necessarily bring them to the physician for screening. And it probably is true that more men ignore symptoms for a while and are a little less, more hesitant to go to the physician.
And one last thing really quickly, a lot of people might be put off by that screening process. Really quickly, what's your message for men and women who look at the process and think, oh, do I really want to go through that? Yeah,
so there's different ways to get screened. You can look for blood in the stool. A colonoscopy is still probably the best way to get screened. And really, it is a screening that is people tolerate reasonably well. The prep's not the greatest, but the day of the colonoscopy, most people tolerate well. And most people, after they get screened, realize it was much easier than they thought.
And it's so worth it to go. All right, Dr. Jeffrey Meyerhart, thank you so much for your insight and your expertise and for joining us this morning. We appreciate it.